People are constantly searching for smarter, safer ways to get rid of unwanted fat, and that's why procedures like Smart Lipo are gaining in popularity. So here to explain how it all works, the beauty coach, Dr. Ann-Therese Stubbs. Thanks for being here, Dr. Ann.
Thanks for having me.
All right, Smart Lipo. It kind of sounds like you would know what it is. Self-explanatory. Explain it.
Well, this is laser liposuction. So traditional liposuction is pretty hard on the body. Usually a patient has to be put to sleep under general anesthetic, and it almost looks like a trocar with almost a cheese grater-like thing on the end that roughs up the fat layer. So it's very rough.
Yes.
It works, but this is what we call smart lipo or laser liposuction. Instead of roughing up the fat layer, we actually melt it with a tiny little laser, and it's done under a local anesthetic in the office.
As far as results, are they similar to liposuction?
Wonderfully similar. In fact, smoother, we would say. So I think it's safer, it's easier to go through on the body, less traumatic, less recovery time, and just a smoother result. We don't kind of get lumps and bumps that sometimes you can get with the traditional lipo.
Okay, so you do have some video. Explain to us kind of how it works and how it is different as we watch it, because it still looks like you have kind of the tube that goes into the body, right?
And so this is basically, you're seeing right now, this is somebody who's already been numbed up, and that's the laser that's right underneath the skin. You can see a little bit of the light near the skin, and this is basically the instrument. It looks like a tiny little piece of maybe angel hair pasta, and it's in a tiny thin little metal tube that goes right underneath the skin, and we melt that all. So we're melting that out. It's all going to turn to liquid, and then that liquid we can safely suction right out with a tiny little metal straw, suction catheter, and so we can get up to 4 liters of fat out in about a 2-hour period right in the office.
Okay, so in that 2 hours, is somebody going to see their results? Do they need to do more treatments of this?
This is a one and done. So this is what people do love about it. So if they're looking to really get a jump start and maybe get rid of the whole middle and kind of love handle area, we can take, like I said, up to 4 liters. So some people opt to do this instead of the less invasive means like maybe cool sculpting, because it is 2 hours in the office. They're awake, have just a little bit of a sedative on board, but they're awake and talking to me. I numb that whole area up, we laser it, and then we suction it. It takes about 2 to 2.5 hours to maybe do a belly and kind of love handles all the way around this whole kind of, this is the most popular area. So, but that's, you know, and they will notice definite size difference right away.
Okay.
They wear a compression garment for about 2 weeks underneath their clothes. They can be up and around the next day. I usually tell people you're going to be sore the next day. You're going to feel like you did about 1,000 crunches. And you won't want to be bending over and picking things up, but if you had a desk job or wanted to work on the computer, you're absolutely fine to do all that the next day. We say don't work out hard for about 2 weeks, and then you're back to your workouts in 2 weeks.
Now, is that the ideal candidate, somebody who just is kind of dealing with that middle area, or is it good on other areas?
It's wonderful in other areas. We do a lot of arms. We do a lot of saddlebags, inner and outer thighs, and so really any area of the body that has a fat deposit that isn't going away.
Okay, and looking at this, this is that back. You know, we like to call them the back fat, right?
Right.
But that is exactly where you targeted.
Exactly, and this is what some people call muffin tops over jeans or just the love handles, and they get a little bit of that ridge right under the bra strap too. And so by taking that fat out, this is a young lady who just struggled after after babies, you know, not getting rid of that. They called it the shelf, you know. Everyone will come in and say,
it's the diet, the exercise, nothing's working. Here we go, yeah.
And so that little pooch right in front is what we worked on there. Same thing in this picture right here, usually 2 tiny little needle holes, very low, kind of in right in the bikini area, and that's the only mark you really have on yourself afterwards. It's about 1 centimeter. We put 1 little suture through it. It heals up fine and might even look like just a mole was taken off or something there, but really no scars from it at all.
And this one just, I mean, looking at these two, it's amazing. I imagine the feedback that you're getting from these patients. Within that 2 hours, they can see a difference, right?
Exactly. So when we get that compression garment on them right at the end, they can already see a difference, and then it tends to get better and better because the heat from the laser to melt the fat also tightens the skin. So we're delivering that heat right underneath the skin, and over the next few weeks, the collagen builds and the skin tightens down.
So it keeps on working?
It does. It gets better and better up to about 6 months.
And what makes it even better is you always have a good offer for us.
We do. Summer is coming, and everybody's thinking about bathing suits and shorts, and so we're offering 20% off of our Smart Lipo procedures, and always a complimentary consultation.
All right, Dr. Ann, always good to have you.
Thanks for having me.